Hi, my name is Keisha Polluck, and I'm a professor at the Johns Hopkins Bloomberg School of Public Health and also a consultant with the Health Impact Project, which is a collaboration of the Robert Wood Johnson Foundation and the Pew Charitable Trusts. Welcome to the IRL course on health impact assessment. And today we'll have a number of modules where we will go through a little bit of the history and the rationale for health impact assessment, and we'll talk through all of the steps in the process. So this first lecture is an introduction to health in all policies and health impact assessment. Just to make sure we're all on the same page, and I know you are familiar with the concept of the social determinants of health, I want to remind you that when we think about those root causes of health, we're talking about those factors beyond the ones that operate at the individual level. So we're thinking about public services and infrastructure, broader policies affecting where you live, work, learn, play, and pray. We're thinking about those social, economic, and political factors. And as you all know, these are really important for our health outcomes, and these are important determinants of health. This image you're looking at is from the World Health Organization Commission on the Social Determinants of Health, and it's probably familiar to you. Now, those of us in public health see this as a problem, this being the fact that these factors that affect health really occur outside of the health sector. And what's problematic is that there are many significant health implications that often go unrecognized that are really being driven by these other sectors. And because of that, there has been a growth in what's called health in all policies, or HIAP is the acronym. So when you hear HIAP or hear me say HIAP, I'm referring to health in all policies. HIAP recognizes that factors outside of the healthcare system play a really large role in determining one's health status. And it also recognizes that not all determinants of health can be controlled by policies within the health sector. And so if we recognize those things, we can think about HIAP as a collaborative approach that considers how health can be integrated at a systems level into policy and programming across all sectors and at all levels to improve the health of all communities and people and to address inequities. HIAP really requires public health practitioners to collaborate with other sectors because what we know about HIAP is that in order to be successful, we have to achieve these mutually beneficial goals. There are a few key elements of HIAP, and they are to promote health, equity, and sustainability considerations, to help support interagency or intersectoral collaborations, to really create co-benefits for multiple partners. So this isn't all about health and public health people saying do this because it's good for health, but it's saying how can we establish co-benefits between public health sectors and transportation sectors, for example, or between public health and housing. HIAP engages a broad array of stakeholders, and it also creates structural process changes. So again, this is at the systems level. This isn't just one decision where health is at the table, but it's a way of saying, how do we change the way we do business so that health is always considered? And finally, a really important key element of HIAP is accountability. Because in order for these strategies and processes that are implemented to have a sustaining and lasting impact, somebody has to be accountable for these systems approaches that are now being part of the usual business of government or some other operations. My purpose today is not to give you a full extensive history about HIAP, but I just wanted to let you know this is not a new concept. HIAP has been around from as early as 1978. We saw some of the earliest comments around HIAP, which was part of the Alma Ata Declaration, and all the way through to recently to the to the Millennium Development Goals post 2015, and a number of points in between that you see on this slide. There are also a number of strategies and tools and tactics that you can use to achieve HIAP. I like to say there's no single way to do health in all policies. And this slide lists a number of strategies we've seen implemented across the country and around the world, ranging from creating new cross-sector government structures, integrating health language into RFPs or requests for proposals, some new workforce development strategies, and finally, using health impact assessment or HIA and related tools. And this is where we're going to focus the rest of our time today in this course. And my goal is to really introduce you to HIA as a concept and to give you a little bit of information about HIA so you can consider using it in your work. So this slide shows you the definition of health impact assessment, and this is from a document produced by the National Research Council in September 2011. And HIA is a structured process. It's not a one-time approach, but it's a process that uses scientific data, professional expertise, and stakeholder input to identify and evaluate those potential public health consequences of proposals. An HIA can be applied to a proposed program, policy, or project. And the goal is to develop pragmatic recommendations that can be taken to minimize those adverse health impacts and really optimize those beneficial ones. HIAs address the determinants of health. So HIAs are asking, how does that proposed project, plan, or policy? Again, this is at a proposal level. So we're not talking about after the decision is made. So this is different than evaluation. And it asks, how does that proposed project or plan influence a number of things? So housing, or access to parks and natural space, or transportation, or quality of life, education, inequities, and ultimately lead to health outcomes. And what we're going to do in this course is talk through how do we actually do that in practice. So HIAs provide a framework for community capacity building and empowerment, and this is achieved through stakeholder engagement, and we have a whole module on stakeholder engagement. HIAs also impact a broad range of individuals. HIAs define health broadly as well. So we're not just talking about one aspect or one dimension of health. We are broadly defining health in terms of physical health, mental health, emotional health, environmental health. HIAs also address health inequities because part of the assessment is to determine how groups might be disproportionately burdened by those health impacts. And we've also shown, there's evidence that HIA also increases transparency and really supports inclusiveness and democracy as part of the policymaking process. And I hope to highlight that point in particular throughout our time together today. There are a number of key values for HIA, and these are really important. These are core to those of us who practice HIA. And these are democracy and transparency, so supporting a democratic and transparent process. Equity, and we'll have a whole lecture on equity. I think it's the second module we'll cover. Sustainable development, ethical use of evidence, and again, a holistic approach to health. So if you are an HIA practitioner, these are the key values that are really core to your practice and that are always at the forefront of your activities. I'm not going to go into other impact assessments, but I did want to let you know that there are a number of other impact assessments, particularly those, some of you in the room or who are watching this video may be familiar with environmental impact assessments, EIAs, and I'll come back to that point in a moment, but I wanted to just let you know that there are equity impact assessments, social impact assessments, integrated impact assessments, and there's actually an international society, and the logo's up here on the screen, called International Association for Impact Assessment. So if you're interested in learning more, the website's here and you can go visit them, and there's an international conference that happens if you want to learn more about these various impact assessments. Turning to HIA practice in the US. So we think that the thing we call the first HIA was done around 1999 by the San Francisco Department of Health, and it was on a living wage policy. So when we think back, the field of HIA in the US is actually not very old. It's only been around since around 2000 or so. But what we've seen is, in terms of HIA practice, we've had a number that have been done as part of the EIA process that I just mentioned. So those environmental impact assessments might include an HIA as part of the analysis. But what we've seen is that most HIAs are done without a specific legislative mandate or regulatory requirement. People just do them because they think it's a good way to think about health and health disparities. And there's been growing activity at the state and local levels across the country. This map captures data through the end of 2016 and shows that across the country, there are over 400 HIAs that have been completed or are in progress to date. And a couple of things to point out is that you see there are a number of HIAs that have been done in California. There are some groups in California that do HIAs, particularly human impact partners. I'll mention them again later. I've been involved with a number of HIAs on federal level decisions, and so there have been 9 of those. A number in Alaska, where we've really seen HIAs focused on oil and gas. And Maryland, where I live, or where I'm coming from, there have been a number of HIAs, and I teach a class on HIA, and we've actually contributed to some of those HIAs, we being my students. HIAs can be applied to a wide variety of sectors. It can be an energy decision around a low-income housing assistance energy program, or LIHEAP. We've seen HIAs for agricultural decisions, so for example, a statewide farm-to-school bill. We've seen HIAs around the built environment. And as I said earlier, they can be applied to policy, project, or programs. So proposed changes to SNAP, for example, or the Supplemental Nutrition Assistance Program, or a zero tolerance program in a school system, for example. One of the resources I provided for this class is this document you see on the screen, and that's called the Minimum Elements and Practice Standards for HIA. And this document was created a few years ago to provide guidance on what's required for a study to be considered an HIA and some benchmarks for effective practice. This is a great document to review if you're interested in conducting a health impact assessment. Here are the steps of the HIA process. We're going to go through these today in various modules, and so I won't sit too long on this slide, but I did want to emphasize that stakeholder engagement is critical for each of these steps. And again, we'll have a specific module on HIA stakeholder engagement and highlight how stakeholder engagement is part of each of these steps. HIAs can take effect or sort of can look very differently depending on the scope, and they can be very sort of short in what we think of as a rapid or desktop HIA to a little bit more detailed where we might have some primary data collection and it's considered more of an intermediate analysis, or more comprehensive that might take a couple of years to get done. The scope really varies based on sort of resources, but also level of stakeholder engagement, types of data being collected, and really sometimes just how much our grants are for. That really helps to drive the scope of the HIA. You might be asking, well, why are more people not doing this? Well, I'll say awareness is growing, but overall, still a lot of people aren't familiar with HIA. The other thing I think is important is that there's limited funding to support HIA practice. And I think with that barrier, we would, if we didn't have that as a concern or a barrier, we'd see many more HIAs being conducted. I've talked to decision makers who are still skeptical about the predictions, and we'll talk about assessment today and about those predictions. People say, well, we don't do it because there's not a requirement to do it either. And also sometimes those impacts are difficult to measure when you think about things like confounding and effect modifying, and how do we actually quantify or even qualitatively describe those impacts, and how do we ensure that they're valid. And finally, HIA may not always be the best tool for the decision that we are looking at. So to recap, these are the key points of HIAs. They're conducted to inform a specific decision. So this isn't an HIA for all decisions related to transportation, but an HIA will target one specific proposal. HIAs utilize a broad analytic framework, and we'll talk more about the various methods that are used. HIAs involve collaboration with a diverse group of stakeholders. They are very pragmatic and focused on solutions. This is not about some document that sits on the shelf or an academic exercise. This is really to help inform decision making. And HIAs address health equity. Again, really important for all of us, and a key element of the RWJF Culture of Health framework. So let me just end our first module with some information about a professional society you may be interested in if you're interested in HIA, and that's called SOPHIA, and that's the Society of Practitioners of HIA. And SOPHIA is an association of leaders and organizations that are really promoting excellence in the practice of HIA. So thank you for your attention and time for this first module, and we'll be back shortly with the second one. Thank you.